Hey everybody, welcome back to my channel. So you're here today because you want to know how to stay healthy during your pregnancy. Well, you've come to the right place because today we will be discussing what steps you need to take in order to maintain your health during your pregnancy journey. So important to stay healthy during your pregnancy, mamas. I want you to get a head start on how to maintain your health during your pregnancy. My name is Sweeta. I'm a registered nurse in the LA area, here to share my new mommyhood experience with you all. If you like this video, please hit the like, subscribe, and hit the bell icon so you don't miss any more upcoming videos. Now let's get started. So now that you're pregnant, taking care of yourself has never been more important. Here's how to keep you and your baby as healthy as possible. Number one, I cannot stress enough, is prenatal health care. The key to protecting the health of your child is to get regular prenatal care. This means as soon as you find out you're pregnant, call your doctor and schedule an appointment because you want to make sure everything is going okay with your baby and with your womb. At your first visit, your healthcare provider will probably do a pregnancy test to confirm, usually a urine or blood test, and then you will find out how many weeks you are and when your due date is. The next thing you're going to want to do is watch your nutrition and supplements. Now that you're eating for 2 or even more, you need about 300 extra calories a day, especially later in your pregnancy when your baby is growing rather quickly. And if you're very thin, very active, or carrying multiples, you'll need even more calories. But if you're overweight, your healthcare provider might advise you to consume fewer extra calories just so you don't get any of those extreme side effects like preeclampsia later down the line. And healthy eating is always important, but especially when you're pregnant. So make sure your calories are coming from nutritious foods that will contribute to your baby's growth and development. And this is how you will keep healthy and also keep your baby healthy. You want to try to maintain a well-balanced diet that includes all the important food groups like lean meats, fruits, veggies, whole grain breads, low-fat dairy products, and of course, lots of water. And by eating a healthy diet, you're more likely to get the nutrients you need. But you will need more of the essential nutrients like calcium, iron, and folic acid than you ever did before you became pregnant, because all that will go directly to your baby and deplete your vitamins. So your healthcare provider will probably prescribe you a prenatal vitamin to be sure both you and your growing baby are getting enough vitamins. But just simply taking a prenatal does not mean you can't eat a diet that's lacking in certain nutrients. It's important to remember that you need to eat well while you're pregnant and just don't depend on the vitamins. Probably going to need a lot of calcium because a lot of women don't get enough calcium. So please take the recommended daily dose of calcium, and you can even eat foods and drink juices that are high in calcium because your baby will be taking all your calcium for their bone absorption and bone growth, and you don't want all your calcium to be depleted. Some good sources of calcium include low-fat dairy products like milk, pasteurized cheese, yogurts, orange juice, soy milk, cereals, and of course dark green veggies like spinach, kale, broccoli, and even tofu and dried beans and even almonds are good examples. You're going to need about 30 milligrams of iron daily, but of course ask your doctor for the right dose because iron is needed to make hemoglobin, which is the oxygen carrying component of red blood cells. These red blood cells will circulate throughout the body to deliver oxygen to all of its cells, and without enough iron, the body can't make enough red blood cells and the body's tissues and organs won't get the oxygen they need to function. So it's important for pregnant women to get enough iron in their daily diets, and especially because their baby will be sucking all the iron out of them during second trimester. So make sure you have enough iron in you, mama, or else you're going to be dizzy, you're probably going to faint, and you don't want to go there. And some iron-rich foods include red meat, dark poultry, salmon, eggs, tofu, enriched grains, dried beans and peas, dried fruits, dark leafy green vegetables, something called blackstrap molasses, and of course the iron fortified cereal. You also need folic acid, mama, because folic acid is very, very important to decrease the risk of neural tube defects for your baby, which is formed during the first several weeks of the pregnancy before the woman even knows she's pregnant. So before you even conceive, you really need to get your hands on the folic acid and take one daily because it's so important to the baby's developing brain and spinal cord. And when the neural tube doesn't form properly, there is a very severe condition known as spina bifida, which your child might not even be able to walk in the future. So make sure you have enough folic acid in your system, especially before trying to conceive, so that you have enough to provide for your growing baby. And it's so important to drink lots of water, especially during your pregnancy, because your blood volume will increase dramatically during pregnancy, and drinking enough water will help prevent common problems like dehydration and constipation and dizziness. So make sure, mama, you're drinking at least 10 cups of water a day, or ask your doctor for the exact amount, but it should be a lot of water. The next thing you want to do to stay healthy is exercise. So you want to do about 30 minutes of moderate intensive aerobic activity each week if you're not already active or doing vigorous intensity activity. This is because if you stay active, your body will be able to fight off infections, fight off anything that's coming in, attack the bad bacteria. Exercise during your pregnancy has been shown to be very beneficial because it could prevent excess weight gain, and also reduce pregnancy-related problems like back pain, swelling, constipation. It could improve your sleep, boost your GABA, increase your energy, boost your mood, prepare your body for labor, and lessen the recovery time after the birth. So again, you want to do stuff like walking or swimming, simple yoga, simple Pilates, maybe some exercise apps, but again, talk to your doctor. And please avoid any sports or activities that pose a risk of falling or any kind of abdominal injury, which is like contact sports like scuba diving, horseback riding, basketball, soccer. So just be sure that you're not doing any of these extreme sports for now. And the very last thing you want to do is try to get sleep, because you probably feel more tired than usual. Your body is making a lot of progesterone at this time, and progesterone is a culprit for making you feel fatigued and kind of sleepy. So make sure that when you do sleep, when you go to bed, you want to lie left or right. Try not to lie on your back because it can press on one of the nerves that feed oxygen to your baby. Just try to sleep left side lying or right side lying only. And you can use many pillows to get yourself comfy. As your belly grows during your third trimester, you'll often find it very hard to sleep. So make sure you're using a good pregnancy pillow, something to support your back when you turn, something to support your belly, and of course, lots of pillows. So I hope some of these tips help you today. Please make sure that you are getting enough fluids, enough nutrients, take your prenatal, get good sleep, and just be active during your pregnancy. Don't just stay home and lay on the bed. And I hope you have a beautiful pregnancy journey. And if you like today's video, make sure you like, subscribe, hit the bell icon, and stay tuned for more. Thanks, guys.